Colorectal cancer is one of the most preventable forms of cancer, and yet it remains the third deadliest in the United States. Henry Ford West Bloomfield Hospital, in partnership with the American Cancer Society, worked on raising awareness within our community with their giant inflatable colon display. Civic Center TV stepped inside this 32-foot-long replica of the human colon to learn about the good and the bad that a person might find on the inside. We talked with Dr. Amit Bhan, Service Chief of Gastroenterology at Henry Ford West Bloomfield Hospital, to learn more about this disease and what we can do to prevent it.
Colon cancer is the second leading cause of cancer death after lung cancer. So it's a huge problem, especially in the United States and the Western world. Colon cancer, what's really important to emphasize is that it is a very preventable cancer, in that we can perform what's called screening, or look inside the colon with various techniques. The most common one being, and probably the best, colonoscopy, to try to find polyps, which are known to be the precursors for colon cancer.
Dr. Bhan explained the importance of screening in order to prevent against colon cancer, or to be able to detect and treat it early.
The best thing a patient can do is get in for regular screening exams, see his primary care physician, and see a gastroenterologist who can actually perform or recommend a varying screening test such as a colonoscopy, and actually get screened. So the average individual, current guidelines from American College of Gastroenterology, American colon cancer recommendations currently are patients at least 50 or older be screened. We start screening at the age of 50. However, there are certain groups of individuals we start younger, say at the age of 40, if per se they have a family history of colon cancer, especially in patients with a first-degree relative like a mother, father, brother, or sister with colon cancer. In those individuals, we may start sooner. And then depending on if we find polyps or not, the screening interval or the times they have the colonoscopy will vary anywhere from 10 years if you have a normal colonoscopy and no family history, to as soon as 3 to 5 years if we do find polyps on the exam.
The average person should get screened every 8 to 10 years, beginning at age 50. However, there are other factors that influence screening frequency, including family history, the presence of polyps, alcohol use, and more.
The statistics are pretty staggering. Only about 1/3 of individuals in the age range 50 to 75 who are eligible for screening actually get screened. So we're missing a large proportion of individuals that should have screening. And since this is a highly preventable disease, by finding colon cancer, but more so removing polyps, we're missing a large proportion of those patients that could get screened. So a display such as this makes someone aware, number one, what the colon is, what the issues are, because it's not an organ we think of very often.
While cancer can be a scary word, it's important that we do not ignore it. Be sure to talk with your doctor about when to begin regular screenings and different options available to you. For more information about colon cancer, including risk factors, prevention, and treatment, please visit henryford.com/colorectal cancer.